if your parents visit you from overseas. So make sure you pay for the cover and maintain OSHC at all times, otherwise your visa might be rescinded. Hi guys, welcome back to my channel. My name is Neha and you're watching IMI Australia. Today's video is one of the most requested videos on my channel, and it is about healthcare in Australia. So you might have heard words like Medicare, private health insurance, all of this if you are planning to move to Australia. In this video, I am going to explain it all to you. So let's get started with today's video. Let's start with the basics. So the healthcare system in Australia is divided into two: Medicare or public health system and private health insurance system. In simple words, Medicare is applicable to all citizens, New Zealand citizens, Australian citizens, permanent residents, and some other visa holders. And for the rest of the population, that is student visa holders, visitors, and certain work visa holders, they all apply for a private health insurance. What is Medicare? So Medicare is the publicly funded universal healthcare insurance scheme in Australia. Medicare is the principal way Australian citizens and permanent residents access most of the healthcare services in Australia. When you enroll in Medicare, government pays some or all of the costs of your necessary healthcare requirements. But medicines are not free, although some of the medicines are subsidized under pharmaceutical benefit scheme. Now, how does this work? How does Medicare work? So working Australians pay Medicare levy as a part of their income tax, and that is one of the reasons why we pay such high rates of income tax here in Australia, because it also covers or includes the Medicare levy. Now, who is eligible for Medicare? So a number of subclasses of visas are eligible for Medicare. Skilled work regional provisional visa, subclass 491, skilled employer sponsored regional provisional visa, subclass 494, permanent residents, citizens, certain humanitarian visa holders. If you have applied for a permanent residency, they're all eligible for Medicare. This also includes, so if you have applied for a permanent residency, it also includes if you have applied for a combined spouse visa, which is subclass 309/100, or if you have applied for subclass 820/801. There are other eligible visa holders for Medicare. I will add a link in the description where you can check if you're eligible for Medicare here in Australia or not. Now that we know what is Medicare and who is eligible for Medicare, let's understand what does Medicare cover. So Medicare covers seeing a GP, which is a general practitioner or a physician, tests and scans like x-rays, most surgeries and procedures performed by doctors, eye tests by optometrists. There are other things that Medicare covers as well, but there are certain other things that Medicare doesn't cover. Some of these are ambulance services, most dental services, glasses, contact lenses, hearing aids, cosmetic surgeries, etc. When you are enrolled in Medicare, it pays some or all of the costs of seeing a doctor. If your doctor chooses to bulk bill, the Medicare covers the cost and you don't have to pay any money at all. But if your doctor doesn't bulk bill, you will need to pay either the full cost of the treatment or the difference between what they charge and what Medicare covers. In case you pay the full charge, if the doctor doesn't bulk bill, there is always an option to go back to Medicare and claim for the money that Medicare would cover. Claiming for money from Medicare is not a difficult process, it's quite easy. So in case you have paid full cost for any of your treatments and you're eligible for Medicare, you can easily go and claim that money. But when you make your appointment, you should always ask the clinic if they bulk bill or not. That just makes the process very simple and easy. But if they don't and you absolutely have to visit the clinic, make sure you claim your money once you're done with your treatment. So I'll give you an example. A couple of months ago, I went to see a specialist and I paid $200 for the appointment. When I reached there for my appointment, I gave my Medicare number to the receptionist and I paid the $200. After a couple of days, I got $140 back in my bank account, which was paid by Medicare. So basically, Medicare paid me for the medical services that the doctor provided, but I think $60 was the appointment or the booking administrative fees that you can't claim when you see a specialist. So I did not get that money back. So I just gave my Medicare number to the receptionist and she actually claimed the money from Medicare for me. So you can even ask if they are going to do it or not for you when you visit a specialist. It's very easy. It's not complicated. If they say no, you can just get the receipt And as I said, you can go on to Medicare website and claim it yourself. Now that we know what Medicare covers versus what it doesn't, let's understand what if your parents visit you from overseas, or what if you're coming to Australia on a student visa. So let's talk about student visa first. So for international students, as a part of their visa condition, they need to maintain overseas student healthcare cover, or OSHC, for the entire duration of their student visa. So if you're coming for a bachelor studies for 3 years, you need OSHC for the entire 3 years of your study period. So make sure you pay for the cover and maintain OSHC at all times, otherwise your visa might be rescinded. OSHC covers the cost of hospital and all the medical services that are provided to you. It's just like a private health insurance for students. The benefit is also paid for ambulance services, which is not covered by Medicare. So that's an added benefit for sure. Now, if you have overseas visitors or family members who are temporarily traveling or living in Australia on a visitor's visa, they would need a private health insurance as well. Otherwise, the out-of-pocket cost for getting treated in hospitals would be just too much for you to bear. Even a small blood test or a visit to a doctor would be hundreds of dollars. So it's better to get a private health insurance for anyone who is visiting to Australia. This insurance enables them to be treated in a private hospital and choose their preferred doctor. And they can also go to a public hospital and get treated. They can also get ambulances. It all depends on the type of private health insurance you have chosen for your friends and family. So this private health insurance can also include extra services such as dental treatment, glasses and contact lenses, physiotherapy, chiropractic and osteopathy. So yeah, just choose the one that suits your need and you should be fine. Now, the next question is how to enroll in a Medicare if you're new to Australia. So there are two ways in which you can enroll in Medicare. I went with the first one, which is I went to my nearest Centrelink office and filled the form, submitted the relevant supporting documents, and within a few weeks, I got my Medicare card in the mail. The other one is just go to the Medicare website, download the form, read what documents you would need, fill all of the forms. It's just one form actually. So fill the form and send all the supporting documents and the fill form to the Medicare office by post, and that should be it. It's quite easy. I will add the link on how to enroll in the description box, so make sure you check that out. So it's been a long video, guys, and I've just talked about Medicare, what it covers, what it doesn't cover, who's eligible, etc., etc. I have not yet talked about private health insurance. So now you know what is the next video on my channel. So private health insurance is a vast topic and a lot of my viewers keep asking me whether they should go for it or not. And in the next video, I'm going to discuss exactly this. So if you have not subscribed to my channel yet, make sure you subscribe, hit the bell notification icon so that you know when I upload my video. Like this video so that it reaches more people. Share it with your friends. Let me know in the comment section if you have any questions. And I will see you in my next video. Bye.